Betty Freeman Boots is Vice President of Human Resources for John Knox Village, as she walks here, and oversees their in-house healthcare clinic. We frankly hadn't worked with Betty as much as we have recently, but I think Betty's got a really great perspective on what they've done at John Knox Village and how she's led the charge to be innovative there. She's joined by Eric Hallerud in the red tie. Eric is the Corporate Safety Manager of the City of Kansas City, Missouri. I've known Eric for I don't know how long, quite a while. And I think all of us, and this isn't to say anything negative about the generation before, but all of us that do a lot of work with the City of Kansas City, Missouri have been so pleased with Eric's existence and work there because he's really charged everybody throughout their provider network and everybody to really do things in an innovative and new way and had success for it. Kelly Gare is the Safety Coordinator for Kansas Department of Transportation. Kelly also has been a real leader in putting some innovative programs into KDOT, as well as a really funny guy. If you get a chance to talk to him offline, he's hilarious, and you got to ask him about how he got his job at KDOT, which is funny. But really, it's another example of somebody, and Kelly and Eric in particular. You look at people that work at public entities, and which are oftentimes struggle with maybe more bureaucracy than the private entities in implementing innovative thought, but they've done it, and they just charged forward and got it done, and have a lot of my respect because of that. And finally, Rachel Chick, HR Generalist for American Eagle Outfitters. American Eagle, this is old news for them. They were innovative before innovative was cool, and they have done some really neat things that we've had the honor to support them with at their workplace and had benefits because of it, and really, I think, are great. So what I'm going to do is I'm going to turn it over to you guys and give you a second just to kind of introduce yourselves and what you've done. Give some 30,000-foot overview of what you've done. So Betty, would you please start?
Sure. Can everyone hear me? I represent John Knox Village, and John Knox Village is what's referred to in the industry as a continuing care community. We have over 1,000 associates. Most of those individuals work in entry-level positions, so they may be landscape, housekeeping, CNA roles, and predominantly female work group. We have an aging workforce, which has presented some challenges for us. Our average age is around 40. So we have looked at and implemented a variety of programs. I don't know, Matt, did you want me to go into those?
Sure. Yeah, I think that'd be great if you want to just give us a...
Excuse
me.
They
can't hear you, Betty, if you want to put the mic a little closer.
Is that better?
Yes.
Okay, thank you. John Knox Village has for some time done a variety of wellness initiatives, but they had been activity-based, and we realized after the second year in a row getting double-digit renewals for our health insurance that we had to do something different. So we, first of all, put through a process where we gathered associates from all parts of our organization and all levels and educated them. We had a task force that we wanted to have us help us with the problem, but they needed to first understand the problem. So we went through an extensive process of helping them understand the numbers, what was going on with our healthcare utilization, and then asked them to give us ideas and suggestions. As a result of that, one idea that kept coming up consistently was having an on-site wellness center. So we did some research, looked at the various providers in this region, and selected through an RFP process the provider that we felt would be the best match for our culture and our mission, and put together a program that is threefold. It provides us with our post-offer exams, which we do for all new hires coming into the organization, and that includes essential function testing as well as drug screening and TB screening. We also included as part of the program our workers' comp management of the health side. And then thirdly, the utilization of the clinic for individuals and their families if they're in our health care plan. And if they're in our health care plan, they're able to use the clinic at no charge as long as they're participating in health risk assessment and health activities. And I'll get into that in a little bit.
Great, thank you.
Okay.
Eric?
Can you hear me okay? My name is Eric Hallerud. I work for the City of Kansas City, Missouri. Been with them for about 3.5 years now. My background prior to that, I've got a master's degree in safety management from University of Central Missouri. Following school, I was a non-traditional student, went back to school, but following that, I went to work for the State of Missouri Division of Workers' Compensation, I spent 8.5 years with them, and I headed the Missouri Workers Safety Program, which was a outreach program that dealt with employers, worked with employers all around the state. We had safety consultants that would go out and talk to employers about how to reduce their experience modifier, how to get their costs down. So came out of school with a master's in safety, but immediately jumped into the work comp world and got a great education there. So when I went to took the job with the city of Kansas City 3.5 years ago, it was in 2008. It was in October, so it was just before the presidential election. We didn't have bailouts yet, but everything looked like it was falling apart. You remember October of 2008, but the city was determined to hire somebody to handle safety for them, occupational safety. We have very high incidence rate, very high experience modifier, and they were motivated and determined to hire somebody. So they hired me as the division of one guy. It's always a great position to be in. You know, when you go to a meeting and they want to talk about the safety division, you go, "That's me." I hadn't had anybody in that role for about 20 years. So I just tell you real quick what the challenges are, and then I guess we're maybe going to come back around, Matt, is that
yes,
right, and talk about things that we've done, challenges I saw. And I saw this as a great opportunity, but a large government entity with a lot of really large departments and somewhat of siloed mentalities in those departments. Everybody kind of sees themselves as a separate piece, not the city as a whole. Being a public entity, you don't have the OSHA oversight, the citations and fines, that kind of thing. So we didn't have that stick over our heads. Self-insured and self-administered for workers' compensation. I think there are some challenges there. I think to a certain degree, you don't know how maybe bad things are if everything's been in-house for a long period of time. We're self-insured. The experience modifier, as bad as it was, doesn't impact us because we're not paying a premium, so we don't have an insurance company coming in beating us over the head saying, "You got to get these costs under control." So we're spending a lot of money. Little understanding of best practices in safety and health, and so a lot of challenges. So that's where I started. I guess we'll come back to solutions.
That's great. Kelly?
Kelly Gear with Kansas Department of Transportation. Been working for KDOT for about 11 years now. What started us off on the pre-employment physical post-offer track is I was sitting in a meeting and they were kind of going over if we still wanted to do physicals prior to employment. We kind of looked at the data and found out about 33% of our claims were by employees with 3 years or less on the job. We were doing physicals prior to that, but we never turned anyone down for the job. Basically, they went to their doctor, came back, they said you could work, so we hired them. I said about 33% was our claim rate in 2009. Last year, we were down to 3.3% for that work group. We're paying about the same out, but with the year difference in the economy, we figured we would have been probably twice as much as we were if we didn't attack that at that time. So currently that's what we're looking at. Another one of our big challenges that we faced is if we had an employee off on work comp, we couldn't hire someone to replace them. So you go to Western Kansas, we have 5 guys in the shop. If one's on work comp, that just meant the crew's doing that much more work. So that's kind of really drove us to look at it.
Rachel?
Good morning. I'm Rachel Chick, and I am a Human Resources with American Eagle Outfitters, and I've been with the company the last 5 years. We kind of have been really partnering with ARC on a number of things. It's really the evolution of what Matt put on the board is really kind of how our relationship started with ARC and kind of has been the catalyst for a number of things we're doing. At American Eagle, we have the tagline of live your life, love your job. And so you find that a lot of people can't live their life, if the job is causing them pain and a number of things. So a lot of our experience started with wanting to get down workers' compensation claims, get a healthier population. What we found, I work at a distribution center that's here in Ottawa, Kansas, is that our distribution population is the target, the people on the map that are not doing well in a number of categories. Whereas at our corporate offices, the wellness initiatives are working very well, numbers of things are happening, and that population really isn't the group of people that they need to target on trying to live better so that they can live their life and love their jobs. So we started going down the slope with workers' compensation, we have made tremendous improvements and have just been nothing but happy with the results. It took time. It's taken years in a number of ways for us to get to where we're at today. It took a lot of negotiating. It took a lot of getting people to, say yes after they'd said no 15 times. But we're really slowly getting to the part where we're able to move this into our, standard healthcare needs, discussing some things about wellness and really just trying to make an impact in our population, and we're trying to do that from the aspect of just health. We're also doing some things, to help people's financial wellness. Just really realizing that the group of population at our employer just really needs some guidance on a number of things that are just not coming naturally to them.
Before I open it up for questions, just ask each of them a few questions. And Betty, we talked about, you just kind of mentioned the in-house clinic that you developed. You want to expand upon that a little bit? Talk to us about how you came to that decision, how you talked about how you evaluated providers and where you see that program going into the future.
Well, we came to the decision that we felt a wellness center or wellness clinic would be of benefit to the associate and the organizations. Through the process I mentioned, we had associates get involved in our selection process and evaluation process, as well as understand the numbers. And we looked at numbers such as ER visits, and we found a lot of our claims, which had gone up significantly, were for items that really didn't belong in the emergency room, like migraine headaches, for example. So once we started looking at those numbers and we started considering our wellness center option, we realized that we needed to have another piece to kind of be the cornerstone of that, and we went self-insured. And I think that's an important piece that allows us to do some management that we wouldn't normally have in terms of access to the numbers. One of the things that we believe in strongly and have done for many years is the post-offer essential functioning, but that was done strictly at an off-site clinic and wasn't in any way integrated with the rest of our wellness programs or our health plan. Now that it's being done as part of our clinic, we have the opportunity for that to be integrated when that person has a health issue and comes in. That nurse practitioner that's staffing the clinic has access to that information and can tie that together. So we believe we will have better outcomes. We are moving in our wellness program from an activity-based to an outcome-based, and we are starting to see, after our first full year results, we are seeing one of the things that I think is very interesting. We're seeing that the individuals in high-risk areas are starting to come down, moving into lower-risk areas. We're seeing people stay at their health level. They're not becoming sicker, which in my view is an improvement if we can at least keep them where they're at and they don't get sicker.
Betty, how many associates do you guys have?
We have over 1,000 associates, and we have about 500 that are in our health insurance plan. And at this time, we restricted the use of the clinic for health needs to those that are in the health plan.
And so, and I don't mean to elaborate, this might be redundant, but if I work for John Knox Village and I go to a medical provider outside of your in-house clinic, I pay a copay and deductible. But if I go to the in-house clinic, how is that different?
It's free. There's no charge.
And that's the incentive to keep it all in-house. So you
Exactly.
Can it's great.
Exactly.
It's great. Eric, those of us that have dealt with the city, I kind of talked about it before. We're so pleased to have you with the city. Thank you so much for being there. But you've done a number of things, modified duty program. I know some reimbursement programs that you've been involved in. Do you want to talk about some of the things that you've done and the outcomes you've had with it?
Sure, happy to. And I guess when we did the introductions, I didn't know how deep to get into this stuff. But when I started with the city, I identified a number of different things that I thought we needed, that we were lacking. One was nurse case management. Another was transitional duty. These are things that everybody in the room is going, yeah, of course you have to have that. And we were just kind of behind the times a little bit in terms of having some of those things and having programs. Functional job descriptions, improving communication and cooperation internally, looking at our provider costs, and another is post-accident drug testing. Those are the big 6 that I wrote down today in terms of the things that I identified coming in early on. We've addressed a lot of those and have made some great strides along those lines. Nurse case management, we contracted with a provider, Jenny Toyne Agency, in 2010, and it's yielded some terrific results for us. We started a transitional duty program at about that same time, and we have cut our TTD in half in that period of time, which is a terrific result. Maybe some of you in the room can relate in terms of establishing transitional duty jobs. It's been difficult in a municipality where you've got a lot of people that are doing field work. It's difficult for some of the departments to envision putting somebody onto what they still want to call a light duty kind of a job. They're having difficulty coming up with them. We've gone to a model of using not-for-profits locally. If we cannot, and we're working hard to find and develop transition duty jobs, but where we absolutely can't place somebody in the city anywhere, we'll use a local not-for-profit, have somebody do some meaningful work out there, get paid, get their full pay. We think it's win-win. We're totally sold on the notion that people get well faster, and it's win-win for everybody if they make their full check. Let's see, functional job descriptions, something again that we didn't have that we're working towards. We're actually working. This is a commercial now for ARC. We're actually starting a pilot program with ARC to do functional job descriptions. Had a meeting recently with the city manager, who's very much bought into the everything that we're doing here. And ARC had recently done that type of work for the city of Topeka, and we were excited about that and shared that with our city manager. And he said, yeah, we need to do that here in Kansas City as well. So a lot of exciting things with some good results happening. I guess the final thing to kind of tie into what Matt said earlier, the notion of tying your safety program in with your wellness program. When I came into the city as a Division I guy, I had to look for partners everywhere I could find them. And we have a program through St. Luke's and Blue Cross Blue Shield called Fountains of Wellness. And I reached out to the directors there, and we've done a number of different initiatives together. I think we have to combine those two things. There's certainly positive buzz that comes out of the wellness program, and that's the kind of buzz I want to have about safety. And I want safety to be safety officers and safety rules and safety violations. I want it to be people making choices to do the right thing, to work safely, to prevent injuries, so that we don't have to get so many people into this system where it's so expensive.
That's great. Kelly, post-offer employment testing, you kind of touched on it there a little bit. Can you talk about how you implemented that, how you went about determining how that was going to happen, and maybe some things unique struggles that maybe a public entity like you face in doing that?
First thing we looked at was which one of our employees were the most high-risk employees to have work comp claims, and we had about 77% of our equipment operators were handing in. That was 77% of the claims were from equipment operators, that series of employee out there. So when we first looked at it, we did the EO series job first. They just did the job analysis, and then we made the test for it. Our next series was the ET series, which is our engineering techs that go out and actually do the inspections for the contractors. They're out on the contractors' jobs all the time. So the next step, we went to them, we did their job analysis. They got a little trickier because we have ETs in the field, and then we do have a big lab in Topeka that does testing. They break beams and all kinds of stuff there, so we had to deal with that side of it. The next series was mechanics. They were about 5%. And then after that, we've done it to the high-risk employees. We have employees that are high at risk, but they haven't handed in very many claims. We have tower climbers that actually climb up to 400-foot towers. So we've done the test for them. Our radio guys, we actually own our own radio system in Kansas. So those guys travel the whole state. So we've done testing for them. And when we do that, it changes their PDs. But we also do the physicals now. Pretty much the physicals, we probably have about 8% failure rate, which was actually a little lower than we thought it would be going into it. But it's the employees we have out there, they're staying longer now. We were having a big turnover in employees. Either they go on work comp and we never see them again, or they stay with us just for a little bit and then they go move on to a different job. Right now we've kind of sustained that. While this all was going on, we did have work freezes where we couldn't hire people. Then suddenly we would have a rush where the governor would say you can hire 200 people, so we'd go out in a rush to hire them. But right now at KDOT, we're sitting right about 3,000 employees that we cover throughout the whole state. And basically, the pre-employment physical is just the first step for us. The next thing we're looking at will be reducing our number of days off on work comp. Right now, the number's pretty huge, so we're just facing how to bring those employees back to work, especially in the rural areas where there's only 6, 8 guys in a shop. How do you bring one guy back to work when it's 110 degrees out and he stays inside while the rest of the crew's out working? So we face those obstacles, but that's going to be our next step to try to get employees back to work.
That's great.